Rob, thanks so much for the invite to be here. I'm the Chief Medical Officer of Precision Oncology Exact Sciences, and I'm a pathologist by training. Sure. Well, Rob, we're involved in providing advanced diagnostics, number one, for the detection of colorectal cancer through our test Cologuard, which is a stool-based assay that identifies patients at risk of having either advanced adenomas or colorectal cancer. We also provide a test called Oncotype DX, the recurrence score for patients with hormone receptor positive breast cancer. And really the assay that we're here to talk about today, the OncoExtra assay, which is a next generation sequencing assay to assess both DNA and RNA. So Rob, the test, first of all, let me just tell you a little bit about the test. This is a test for patients with advanced stage cancer, stage 3 or stage 4 cancers, where time is of the essence. And the OncoExtra test uses next generation sequencing platform. And we test not only DNA, where we test the whole exome or all 20,000 genes, but also we do RNA-seq, where we test all the RNA. And RNA is particularly important to be able to understand an important type of variant called a fusion or a structural variant. So OncoExtra uses both DNA and RNA-seq, and that way it also provides for preservation of tumor tissue and really gives the most comprehensive blueprint of a patient's tumor that's available. Now, we also provide additional information with respect to immune therapy through a TMB assessment, as well as microsatellite instability assessment. And then the physician also has the opportunity to order immunohistochemical tests that might further help inform a treatment decision, like PD-L1 or MMR testing. Well, today what we're seeing is there's a lot of progress right now in targeted therapies. There's over 100+ different targeted therapies, and oftentimes tumor samples are really scant. So what you want to do to have the best shot on the therapeutic goal is to be able to test for all those variants with a single sample. So OncoExtra enables a physician to test not only DNA, but RNA, and if needed, immunohistochemistry, in order to better understand, does the patient have a potential driver variant for which there could be a targeted therapy? Second of all, not all patients have a variant that is targetable, but there are variants that make a patient eligible for clinical trials. And again, for patients with advanced cancer, really speed is of the essence, and this assay provides all that information in a single comprehensive, easy to read patient report. Our teams right now are also working on tests for molecular residual disease, or MRD. These are tests that will help. They'll use sequencing technology to understand, after surgery, is there any residual tumor left? Do you see circulating tumor DNA in the patient's blood that might require therapy or additional therapy? MRD is also going to be a fabulous tool for being able to follow patients, to monitor them, to see if their disease is coming back. So we have a lot of initiatives right now in MRD. The other area that we're very interested in is in advanced screening or multi-cancer early detection, where again, using next generation sequencing, being able to look in the blood to see if a patient has any evidence of an occult malignancy that could be diagnosed earlier and treated more effectively than waiting for it to present clinically. I think that the key thing is right now, the therapy space right now is rapidly evolving, testing is rapidly evolving, and guidelines are evolving. Now the ASCO guidelines recommend not only DNA testing, but also RNA testing. The OncoExtra is a super assay to be able, from a single sample, to be able to both test for DNA variants, but also RNA variants. Critically, that RNA can help identify whether or not there's a special type of variant called a fusion there. And this really provides for optimal patient care in the most expeditious manner.